Hi, my name is Henry Young. Today we'll be talking about the dengue outbreak in Martin County, Florida in 2013. Dengue disease is also known as breakbone fever due to the severe pain that it can cause in your muscles and bones. Dengue disease is caused by a dengue virus. There are four types of dengue virus: DENV1, 2, 3, and 4, with DENV1 being the most common. Dengue is endemic in the tropics and subtropics. While it is not endemic in the United States, it is commonly found in regions that U.S. citizens travel to for tourism, such as Latin America, Puerto Rico, the Pacific Islands, and Southeast Asia. Currently, more than one-third of the world's population live in a dengue endemic area and are at risk for dengue infections. There are greater than 100 million cases of dengue infections worldwide each year, and according to the World Health Organization, that number is growing. Dengue disease is a mosquito-borne disease that is primarily transmitted by the female Aedes aegypti and Aedes albopictus. Rarely, dengue can be transmitted from human to human via blood transfusions or organ transplant from infected donors, but this is extremely rare. More commonly, the virus is transmitted when the mosquito bites an infected individual. Infected humans can transmit the virus for 4 to 5 days when the viral load is very high in the bloodstream. The Aedes mosquito is able to bite multiple individuals in each feed and is therefore able to spread the infection to multiple individuals during that time. The Aedes lays its eggs in water-filled containers, often found in home and on patios, such as discarded tires, flower basins, ornamental fountains. Eggs hatch when they are submerged in water. The female lays dozens of eggs up to 5 times during their lifetime. The dengue mosquito is able to fly several hundred yards looking for water-filled containers to lay their eggs, and a few mosquitoes per household can produce large dengue outbreaks. Once infected, dengue has an incubation period of 4 to 7 days. Most commonly, individuals with dengue infections have only mild symptoms, and some are completely asymptomatic. The most common symptoms is fever, abdominal pain, muscle and bone pain, and rash. Some individuals have much more severe form of the disease known as hemorrhagic fever that is associated with severe fever, pain, bleeding, organ failure, and can be fatal. Symptoms for dengue infections usually last 2 to 7 days. There is no specific treatment or cure for dengue fever, and treatment is primarily supportive. However, early treatment is very important because in severe dengue cases, it has been shown to lower fatality from 20% to 1%. In Martin County, the trigger case was identified on August 14th. It was the first reported case. The symptoms started on August 1st per the patient. Initially, the healthcare providers were not sure what caused the infection and thought that the infection may be the result of a chemical exposure. After dengue testing confirmed the initial case, 2 additional exposures occurred during the same week. All 3 of the initial cases have been bitten by mosquitoes while in the Rio neighborhood in Martin County. After the diagnosis was confirmed, the county health department released a mosquito-borne illness advisory and intensified active surveillance and mosquito control efforts. By August 23rd, there were 7 total cases in Martin County, and some cases were identified in downtown Jensen Beach, a neighboring community. After which, a local emergency was declared. Marty Baum, who was one of the first individuals infected, described the infection as, "There's absolutely no comfortable way to be. If you lie still, it hurts. If you move, it hurts." There are multiple tests that can be used to identify or confirm a dengue infection. Early in the infection, reverse transcriptase polymerase chain reaction can be used to identify portions of the dengue virus or a dengue virus non-structural protein known as NS1. The quantities of these are high early in the infection and then begin to decrease. Antibodies to the dengue virus, such as IgM antibodies, can also be used to assess for a dengue infection using enzyme-linked immunosorbent assay or ELISA. However, IgM levels remain elevated for quite some time and could represent an infection as long ago as 3 months. IgM could also be elevated if the individual was exposed to other similar viruses such as yellow fever or West Nile virus. This knowledge of when each of these sources peaked and the limitations associated with each one was used to design the approach to evaluate this outbreak. Here are the definitions used to categorize each individual. Clinical case definition for dengue infection was a febrile illness with two or more of the following: ocular pain, headache, rash, myalgia, arthralgia, leukopenia, or hemorrhagic findings. An individual was classified as a suspected case if they met the clinical case definition and were linked epidemiologically to a case of dengue. An individual was classified as probable if they met the clinical case definition and had laboratory findings concerning for a presumptive infection, such as IgM antibodies. An individual was classified as a confirmed case if they met the clinical case definition and had confirmatory lab results, such as reverse transcriptase polymerase chain reaction for dengue virus nucleic acid or dengue NS1. After the first three cases were identified, public health surveillance increased. All symptomatic patients that presented to the local Martin healthcare system were tested for dengue virus. If the individual presented during the acute phase of the infection, which was defined as within 5 days of onset of symptoms, they underwent testing using RT-PCR to detect dengue virus nucleic acid or NS1. If the individual presented greater than 5 days after the onset of symptoms, or the RT-PCR was negative, then IgM antibody testing was performed. To determine the extent of the disease in the community, the health department began active surveillance in the community. For this, the health department used two approaches to sample the community. First, random sampling was used to identify households within 1 kilometer radius of each index case. Then, cluster sampling was used of all businesses within 100 meters radius of the index exposure. All residents completed a questionnaire regarding dengue risk factors, travel history, and medical history. All residents also provided blood samples for dengue testing. This approach was important to identify individuals that did not present to the healthcare system, were asymptomatic, or had only mild symptoms. The information gathered from these surveys were also used to inform the public health response to this outbreak. After the active surveillance was completed, there were 28 individuals identified to have recent dengue infection. 24 of those individuals reported symptoms consistent with dengue infection. 21 of these individuals were identified by the epidemiology team, and 3 of these were identified through the active surveillance of the serosurvey. The survey was able to identify 4 asymptomatic individuals as well. In all, there were 6 hospitalizations related to the dengue outbreak, and all individuals were infected with the DENV1 virus. This is the epidemiology curve of this outbreak provided by the Florida Department of Health. This graph displays the week the illness started for the 24 individuals that reported symptoms related to their dengue infection. All individuals involved in this outbreak became ill between June 16th and September 8th. From the survey, the Martin County Health Department learned that all 28 infected individuals had potential mosquito exposure in Jensen or Rio and had not traveled recently. 71% of the households participating in the survey had sources of standing water in their yards, and individuals with standing water in their homes and individuals that empty the standing water less than once a week were at increased risk to become infected with dengue. Only 13% of the individuals surveyed stated that they always wear mosquito repellent when they are outside. The results from the survey were used to inform the public health response for this outbreak. Because the primary vector for dengue transmission is the Aedes mosquito, the Martin County mosquito control teams responded early in this outbreak to assess the local Aedes population. The control teams went door to door throughout the community identifying potential breeding grounds for the Aedes aegypti. On August 25th, 11 days after the initial case was identified, the Martin County Mosquito Control Team found that 38% of the homes in Rio had areas with Aedes aegypti larvae. These areas were treated, and upon second assessment in September, only 18% of locations in Rio had Aedes larvae. When the assessment was expanded to involve nearby Jensen Beach, 100% of sites tested had Aedes larvae. After treatment of these sites, the following inspection found almost no signs of Aedes aegypti breeding. The Martin County Health Department responded to this outbreak promptly by increasing public awareness by using public service announcements, distributing educational material door to door, over the radio, and even over the television. They also promoted the drain and cover approach, which encourages draining standing water, covering your skin, using mosquito repellent, and covering windows with screens to keep mosquitoes out of your home. The CDC provided local training to healthcare providers about identifying, screening, and reporting potential dengue cases. Although a rare form of transmission, blood banks in the area halted all blood transfusions for Martin and St. Lucie County during the outbreak, and there was enhanced mosquito control efforts. The long-term control measures involved maintaining an effective mosquito control program, continuing to promote drain and cover, active surveillance, and the development of vaccinations. In 2015, the company Sanofi introduced the first dengue vaccine, known as Dengvaxia. The WHO currently recommends considering vaccination for individuals that live in areas with high disease burden. Additional vaccines are currently undergoing further testing. Overall, the Martin County Health Department did an excellent job in addressing this outbreak with a response that was both rapid and thorough. This outbreak was significant because it represents an increase in frequency of mosquito-borne illnesses in Florida. Prior to the outbreak in Key West in 2009, the last dengue outbreak in Florida was in 1934. However, since the outbreak, there have been reports of dengue infections in Florida almost every year. The outbreak in Martin County also represented a phylogenetically different virus that was introduced into Florida and has resulted in persistent transmission. Another cause for concern is the vector that transmits these viruses can also transmit other viruses such as Zika, yellow fever, or chikungunya. This highlights the importance of maintaining an effective mosquito control program and continued surveillance.